Spinal degenerative disease probably should not even be called disease because it's just a natural process of aging. If you go back to antiquity, there have been reports of people with sciatica and symptoms consistent with a pinched nerve. I mean, you would never read that in sort of ancient medical texts, but that's what it was. Versus you would rarely hear of anything that was consistent with degenerative spinal disease, and that's because it's really a more recent entity as we're living longer. So what happens is the discs degenerate, they collapse, they bulge. The vertebral bodies in response to that tend to develop bone spurs. And while on the outside, that doesn't necessarily cause any problems, perhaps it gives you a little bit of back stiffness and some limited immobility, but the issue that it creates deep inside is that the opening for the nerves when you're young, if it's this big, as things collapse and shrink down as you get older, it gets a lot smaller. As it gets smaller, in the right setting, it can start to compress the nerves. And that's essentially what spinal stenosis is as we get older. So that would be the most common manifestation of degenerative spinal issues or degenerative spinal disease, if you want to call it that. But all degenerative spinal disease is just a response to us living life here on planet Earth with gravity weighing down on our spine every day.